Hello and welcome everyone to Quality Week with the Adverse Events team. Thank you very much for joining us today, and we hope you enjoy this short session about adverse events. For today's session, we will be giving you an overview on adverse events to help provide you with the knowledge and a bit more of an understanding of what an adverse event is, and also to describe the process of how and when to report it onto the incident reporting system. This information will support you should you ever experience or be involved in an adverse event occurring. It's helpful to know the best way to report it. Firstly, I'd like to give you some detail about the remit of the adverse events team. As part of the assurance team, we sit within the Quality Directorate and we provide advice and guidance on the management of adverse events, ensuring that all adverse events data is reported, it's acted upon, and also that it's analysed accordingly. We also develop and implement the systems to manage adverse events, such as the incident reporting system, and we ensure that all events are thoroughly and appropriately investigated. We're involved in supporting the sharing of lessons learned from adverse events across the organisation, and one of the ways we try to do this is by using the Learning Bulletin as a vehicle of communication, which is produced quarterly and circulated throughout the organisation. You may already have seen a copy of this, but if not, and would like to, please get in touch with us and we'll be happy to share these with you.
What is an adverse event? It can be known by many names: an incident, an occurrence, an event. An adverse event is an unexpected or unintended event that could have or did result in harm to people or groups of people. Harm is defined as an injury, suffering, disability, ill health, or death to a person. Some examples of harm to a person or groups of people could be a result from worsening of a medical condition, violence and aggression, system failure, or service disruption. Serious incidents are also likely to produce significant legal, media, or other interest, which, in addition to harm, loss, or damage, may result in loss of the board's reputation or assets. Grading of any adverse event is mandatory. The grading outcome will be based on the severity of the impact and will be expressed as either a Category 1, Category 2, or Category 3. Category 1 gradings are events that have contributed to or resulted in permanent harm. Category 2 gradings are events that have contributed to or resulted in temporary harm. Category 3 gradings are events that had the potential to cause harm. These definitions and gradings are explained further in our Adverse Events Management Policy, which can be found on our Adverse Events First Port page.
What is a near miss? Staff should report anything that causes them concern, including near misses. The term near miss can cover two different scenarios. The first is when an error or omission occurred which could have caused harm, but fortunately on this occasion there was no adverse outcome. An example of this could be the wrong medication was given, but it did not harm the patient. The second is when the error was about to take place and a last-minute intervention prevented the incident from occurring. An example of this could be a medication prescription error, but it was identified before administration. Reports of near-miss events are helpful as a source of learning for adverse events resulting in harm. What is a never event? A never event is an incident that should be avoidable if available preventative measures have been implemented and when occur are associated with tragic consequences. The occurrence of a never event may be an indicator of failings or weaknesses in the organisation's core safety processes. Each never event type must be able to be clearly defined and its occurrence easily recognised. This helps minimise disputes around classification and ensures focus on learning and improving patient safety. If a never event occurs, regardless of the outcome, it must be reported on the incident reporting system. Now we're going to look at when and how to report an adverse event. All incidents, including near misses, must be reported and recorded. Those recorded will then be reviewed. Based on the outcome of the incident and the categorisation of grading, there will be the need to consider what level of review is required. For Category 1 graded incidents, a full significant adverse event review, which is referred to as a SARE, can be commissioned for a full review to be carried out. The review should commence as soon as possible and be completed within 150 calendar days from the incident being identified or notified to the organisation. Some Category 2 moderate graded incidents, depending on the circumstances of the event, may require a briefing note to be completed and consideration given to determine if a full SARE is necessary. If the decision to carry out a briefing note review will suffice, the completion of this review should be completed within 30 days. Other Category 2 moderate events reported may require the ward or area to consider taking advice from a specialist or support service outside the area and close the incident within 30 days. A Category 2 minor incident would require a local management review and be completed within 30 days. And finally, for a Category 3 incident, the review should include further inquiries and questions and approved and closed within 10 days of being reported, with any learning points or improvement measures being communicated and monitored at ward and department meetings.
What is a SARE? This stands for Significant Adverse Event Review. It's an extensive review due to the complexity of the case, which can also provide potential learning too. A SARE can involve several staff members to be part of the review group covering multiple departments or specialties. These require comprehensive investigation and system analysis techniques to take into account the chronology, system and care delivery problems, and any contributing human factors. The incidents have or could have significant catastrophic impact on the patient and may adversely affect the organisation and staff and have potential for wider learning. Next, we will look at what a briefing note is. This is a communication tool used to notify when a significant, serious event has happened and used to support the decision on whether a SARE is required. It is formatted to capture the required details of the event and act as a rapid alert to the relevant Commissioner. There should be enough detail on the briefing note to provide the Commissioner with enough information to decide if a SARE is required or not. The briefing note must be completed and submitted to the Commissioner as soon as possible from the time of the incident occurring. The Adverse Events Toolkit has a wealth of tools for use to help support adverse event reviews, including pathways, processes, templates, information leaflets, guidance documents, and many more.
You can find lots of useful information and guidance on the Adverse Events page on Firstport, which can be found using the Staff Support tab, then search for Quality Directorate and select the Assurance tab. Should you need to contact us for any guidance, advice or have any issues, please do so using the mailbox address shown on this slide, which can also be found on the global email list. I would like to thank you all for taking the time to watch this presentation today and hope that you found it useful.
Coming soon. A new incident reporting system is being introduced later in the year. InPhase Oversight Solution will be replacing Datix as the new integrated incident risk management and patient safety system for NHS Lanarkshire. InPhase is a cloud-based platform which offers over 20 apps delivering compliance, assurance and continuous improvement. With triangulated data across the different modules, the system will be able to deliver powerful insights to the organisation, showing trends that allowed focused improvement. This is currently in the initial stages. Further information and updates will be shared very soon, with communication being cascaded throughout the organisation.